progressive, respectful, mentoring, compassionate. These are the values of Palmdale Regional Medical Center. And now we proudly present Palmdale Regional Radio. Here's Melanie Cole.
If you're considering bariatric surgery, you might want to know about national standards for bariatric surgery centers with a goal of advancing safe and high-quality care for bariatric surgery patients. My guest to tell us about that today is Dr. John Yadegar. He's the Chief of Surgery and Medical Director of the Metabolic and Bariatric Surgery Center at Palmdale Regional Medical Center. Dr. Yadegar, tell us a little bit about the bariatric program at Palmdale Regional Medical Center. Tell us about that first.
Right. Good morning, and thanks for the opportunity. So the program that is currently in existence at the Palmdale Regional Medical Center has been here for 15 years, and it was set from its infancy with one thing in mind, which was really optimal patient outcome and patient care. And so to that end, when we started the program, it was a multidisciplinary program with the approach being very clinically driven. And so we wanted to make sure that everything was done very algorithmically, which means that there's a very standardized process. And of course, it is individualized for every patient, but based on those standards. And over the course of the years, as the numbers of patients that were operated on and were treated through the program, these numbers have been nationally essentially gathered and studied, and we've had outcomes that have been outstanding. And as part of this, we were accredited by the Metabolic and Bariatric Surgery Accreditation and Quality Improvement Program, which in short is MBS-AQIP. And the program got certified through this institution, the American Society of Metabolic and Bariatric Surgery, 3 years ago. And it's every 3-year renewal. And in fact, we are about to go for recertification in the next 2-3 months. And it is a way of assessing the safety of the programs nationally in the United States. And of course, it sets the standard platform for other insurance carriers to follow. And so as a result of these Center of Excellence that we achieved, we then were granted the Center of Excellence by other insurance carriers, which include the Blue Cross Blue Shield and Cigna, and some of the other programs that utilize us, again, have their own requirements. And so it is a way of ensuring that all the programs follow standards of care with good outcomes that are reportable, and that allows us to always look for improvements and make it better. And it's an ongoing process. And so we are very proud of the team that has really worked very hard to achieve this. And we are very grateful to our patients for allowing us to continue their care.
Doctor, what did you have to do to earn this designation? And also tell us what types of care are involved. Does it require the management of several aspects of care with improved coordination between providers?
So the important thing, of course, is data entry. And, you have to make sure the individuals who study these patient populations are familiar with the importance of entering the correct and relevant data. Now, these include suitability of the patient selection criteria, how they did after which particular kind of surgery, how long were they in hospital, when they left, how well did they do, whether they had potential complications that made them come back to the hospital, if they continued for follow-up, and the follow-ups are usually quarterly, and if they continue to improve as far as their weight loss and improvement in their comorbidities, which are conditions such as diabetes, blood pressure, cholesterol, sleep apnea. And so we track all of these to make sure that as a result of their weight loss, they've actually gotten rid of their diabetes, they've gotten rid of their blood pressure, and therefore the surgery that they did complete has led them to a better quality of life. And when you have all of that data entered and you're compared nationally with other institutions and you know that the patients have good follow-up and good outcomes, that allows the institutions to say, okay, so we are doing a very good job and we just build on that. And so the team that is put together, it's a team of qualified physicians, nurses, nutritionists, psychiatrists, and all the nurses who follow the patients, including the nurse coordinator, and all of that together constitute a strong program. And that's really exemplified in the program at Palmdale.
Well, it certainly is a multidisciplinary approach to bariatric surgery. Tell us how you have to maintain to keep this designation, certain physical resources, and you've mentioned reporting. So speak about how all that works together for standard of practice.
Right. So the data that is gathered and entered is then put in through the MBS QIP survey system. And then every quarterly, these numbers are looked at. And based on those, the reports are fed back to the program to say, well, based on our review, you seem to have a very good 30-day outcome. You've had no returns to the emergency room, no potential complications. And actually, when the last quarter this was audited, we ended up having exemplary in 2 of those criteria, in that we had no potential, return back to surgery, no returns back to the hospital, no returns for complications. So when you get these differentials assessed, and if there are areas that you need to troubleshoot, it gives the institution an opportunity to improve their performance. And as we said, is ongoing. So these data that are put in are analyzed, and the feedback comes back to the institution, and you make the adjustments. And of course, every 3 years, when you have the overall oversight before you recertify, all of that is going to be taken into consideration.
So wrap it up for us. What would you like listeners to know about this exemplary distinction that you've received, and why it's so important for a center, a bariatric center, to have this designation?
So, the patients who have obesity and challenges associated with that often come in reasonably well informed, because they've studied and they've talked to other patients, and they've been on the web, and they've kind of looked into the options they have. What I would probably like to emphasize is that it's very important to be very educated about the options that you have and the facility that you decide to have the surgery in. And the reason why that is that you want to make sure that the center that you go is well tuned in to the needs and the holistic needs of a patient. And that will include not just getting the surgery. It includes all the affiliations and all the stuff that's associated with aftercare. Am I going to have access to nutritionists? Am I going to have access to the surgeon? Am I going to have access to the nurses? Am I going to have good follow-up? Am I going to have good education, good instructions? Because in the older days, when some of the programs would just operate and the patient was not really well informed and had no follow-up, the outcomes suffered. So we want to make sure that our patients are well informed, that when they look into choosing the surgeon in the hospital, that they make sure that they're accredited surgeons, accredited programs, and that they have a good track record, and that they look at all of those, so that way they ensure that they're in good hands, and God willing, they go and have the surgery with good outcomes and an improvement in the quality of life. And we're very blessed that we've had a very good support system, and that we've managed to achieve the standard that we have. And we're very proud of it. And of course, as I said, we continue to strive to improve upon that every day. And it's important for the patient that they meet the surgeon, that they have a comfortable connection, because, it's going to be an ongoing process, and you want to make sure that the physician and the patient have that established comfort zone, that they're going to continue this relationship long term, because that's good for the patient, it's good for the practice, and it makes sure that, you have good insight as a physician to your patient and as a patient to the practice. And it's a marriage. And we want the patient to look into that from the very get-go, to feel comfortable with what they're committing themselves to. And so I hope that anyone who's considering this really takes the time to evaluate all of those before they make that decision.
So important. And thank you so much for explaining what that means and what that designation means for patients as far as a good quality bariatric surgery center. Thank you again for joining us. You're listening to Palmdale Regional Radio with Palmdale Regional Medical Center. For more information, please visit palmdaleregional.com. Physicians are independent practitioners who are not employees or agents of Palmdale Regional Medical Center. The hospital shall not be liable for actions or treatments provided by physicians. Individual results may vary. There are risks associated with any surgical procedure. Speak with your physician about these risks to find out if bariatric surgery is right for you. This is Melanie Cole. Thanks so much for listening.